When you start Medicare, you quickly find out how complicated it is and all the things that you need to figure out on what to do to make sure that you get it right, because this is really important. It's likely going to be the health insurance you're going to have for the rest of your life. So we want to make sure that we make the right decisions right at the beginning. I'm going to make it as easy as possible. We're going to figure this out. And it's easiest when we kind of do it in pieces. So to understand the best parts of the things that we need to do. And obviously the first choice is, are you going to choose Medicare Advantage or are you going to choose to stay on original Medicare? And if you watch any of my other videos, you know that I personally would never choose Medicare Advantage. I don't want to give up my freedom, my flexibility, the ability to choose whatever doctor I want to go to, whatever hospital I want to go to. I want to be able to have control over my health care in the future. So absolutely, my choice would be to stay with original Medicare, Part A, Part B, and then you'll likely have a Medicare supplement plan that covers the stuff that A and B do not. Now, the good news is Medicare is actually terrific. I mean, it's better health insurance than you've likely had at any time in your life up until this stage. So the cost is very reasonable. The out-of-pocket is very low. It just makes it easy to use when it's time to use it. I'm talking about original Medicare. Medicare Advantage can be a different story. But with original Medicare, A and B, and a Medicare supplement plan, very low out-of-pocket costs when you go to use it. Plus, you can choose whichever doctor you want. As long as they take Medicare, you can go anywhere you want, anywhere in the country. Makes all the sense in the world. So now we have to figure out which Medicare supplement plan is the best. And I'm going to show you the differences and what you're going to be choosing from. So it's really not as complicated as they make it out to be. Now, Medicare comes out with this chart of Medicare supplement options, and there's, I believe, 11 of them here, which is just way too many. There's actually 12. They hide one of them, which is actually a pretty good choice in certain parts of the country, and I'll explain that as well. But we need to break this down. We don't need all these different choices. They usually vary just a little bit, so it doesn't make any sense to have so many options. So what you have seen in the past is Plan F was kind of like the Cadillac. So that was easily the most selected Medicare supplement plan in the past. If you have somebody older on Medicare, chances are they were on Medicare Supplement Plan F. Now, what has happened recently, if you have turned 65 after 2020, you no longer have F to choose from. But that's okay, because F was overpriced. So it had great coverage, but it was overpriced. So no point in paying more just because it has great coverage. But a lot of agents would sell it because it also paid a very high commission when they sold it because the price was high. So we want to find value. And again, F was definitely not value. I have thousands of clients. I think I have one or two that are on Plan F. But so the way it works, so we can kind of understand the differences between the plans. And what I'm going to talk about right now is Plan F, Plan G, Plan N, and Plan GHD. Those are the four things that we need to kind of have in our brain to understand what our choice should be. So forget the other 11, and really G and N for most people is what it's going to come down to. So when we look at how they work, Plan F, going back to that Cadillac plan, literally covered 100% of everything. So Medicare Part A, which is stuff that happens in the hospital, has a big deductible. Right now it's $1,640. And you would be responsible for that deductible if you did not have a supplement plan. But the good news is pretty much every supplement plan covers that deductible. So if you're admitted in the hospital, really no out-of-pocket costs whatsoever. Now Medicare Part B covers stuff that goes on outside of the hospital. And it has a small deductible. Right now it's $240. And Part B also has coinsurance. It has 20% coinsurance. So meaning Medicare pays 80%, you're responsible for 20%. The problem with that is that 20% has no stop. So if you had a catastrophic year, that 20% could easily get out of control. Good news is supplements generally cover that 20%. So it keeps the out-of-pocket costs super low, makes it really easy to use. So back to figuring out which plan works in your situation. So Plan F covered 100% of everything. Covered that Part A deductible, covered the Part B deductible, covered the Part B coinsurance. And really, in the insurance world, 100% coverage doesn't make sense because it kind of promotes overutilization. In other words, people go to the doctor when they don't really need to go to the doctor because it doesn't cost them anything. There's no thought involved on whether or not to go to the doctor. Some people go just for company when they're lonely, which obviously would create rate increases and things like that. But again, right now, unless you were born, turned 65 before 2020, Plan F isn't even available, so we don't have to think about it. I just wanted to jump in for a quick second and invite you to join my private Facebook group, Talking Medicare, where you can get answers to just about any questions on Medicare and interactions with others that are also in Medicare. There are no agents, no sales whatsoever. It's absolutely free. Just visit TalkingMedicareGroup.com. It'll take you right there. You can sign up for free. Easy to do. Enjoy the video. So let's look at Plan G. Plan G is literally exactly the same as Plan F. So exactly the same with one small difference. It does not cover the Part B deductible. So that $240 annual deductible is pretty much the only thing that Plan G does not cover. And that's stuff outside of the hospital. So if you're on a Medicare, traditional Medicare A and B, and you have Supplement Plan G, the most you're going to spend during the year is $240. So again, kind of outrageously inexpensive to use. It's almost too good, but we will take it while we have it. So, and that's for stuff that goes on outside the hospital. If you're admitted into the hospital, there's no cost. It covers everything that goes on inpatient hospital. So if you are on Plan G, you would have an annual $240 deductible from January to January, and then it resets the next January, and then it turns into Plan F, 100% of everything covered. Terrific. And it would certainly be the plan to choose, assuming the premium is where it should be. So it gets a little more complicated figuring out cost-wise and value-wise, because some states have lower premium on Plan G, some states have much higher premium on Plan G. So it really depends on your zip code, and that's what we do. We help figure out exactly which plan makes the most sense in your zip code, and we help get everything set up so that all the pieces are put in the right places and you don't have to think about this stuff anymore. And the best part is there's no cost to you to let us help you. Everything that we do, we're compensated by whichever insurance carrier we choose to be your service agent now and in the future. So absolutely no cost to you whatsoever to allow us to help you. I hope you will certainly allow us to help you. Now let's look at the next choice, Plan N. So we talked about F, G, now we're going to talk about Plan N. Plan N, also exactly the same as Plan F, with just a couple of differences. So it works exactly the same. Plan N also does not cover that Part B deductible. So you have that $240 a year deductible. Now Plan N also has a couple of copays. It has a $20 copay if you go to the doctor. So if you go to a doctor's office visit or a specialist visit, it's going to be a $20 copay. Actually, it's up to $20. A lot of times it's like $13. It just depends on whatever the situation may be. But up maximum $20 copay. Really not a big deal. And why we would choose Plan N if it's enough less in premium than Plan G. Now with Plan N, there's one other caveat. It's called excess charges that some people kind of get caught up in, but it's really not something to be too concerned about. Excess charges means that if a doctor does not take Medicare assignment, if they just take Medicare, then they can bill you 15% more than what Medicare pays them. Now, the vast majority of doctors take Medicare assignment, which means they take Medicare payment in full. No billing after Medicare payment. I mean, literally 9 out of 10 doctors, it'd almost be very difficult to find one that is not on Medicare assignment. So the balanced billing really isn't a concern. And even if it was, it would be a small amount generally, like $10 or $20. So it's not a significant reason to shy away from Plan N, and I think it's a terrific choice if the price is right. So when I would choose Plan N over Plan G is if Plan N is more than $25 less in premium than Plan G. So that's $300 a year less in premium to take on that $20 office copay. There's also a $50 copay if you go to the emergency room, but that's a pretty good deal going to the emergency room if it only costs 50 bucks. So, some people actually do that instead of going to urgent care because it can be cheaper to actually just go to the emergency room. But Plan N is a fantastic choice as long as the premium is lower. And what I try to do with most of the people we deal with is get close to $100 a month, sometimes less than $100 a month, sometimes reasonably less than $100 a month. So if Plan G in your area is close to that range, again, terrific coverage where you only have the Part B deductible, or if Plan N is lower in price and you only have that Part B deductible and a $20 copay, then it's a fantastic deal. So the last one to talk about is GHD. And why would we talk about GHD? A lot of times you won't ever hear about GHD. The HD stands for high deductible. So it's a high deductible plan where right now the deductible is $2,800, which sounds kind of high, but it might not even be higher than what you have right now. But from a Medicare standpoint, $2,800 is kind of high. But let's understand exactly how GHD works. So GHD, like the other two, exactly the same as Plan F, except it has that deductible of $2,800. So in understanding how that functions, and first, why would I choose to have that big deductible? Because it can bring the premium down significantly. So it can make your monthly premium, $60 or $70 a month, which is fantastic. And again, it works pretty well. So understanding how it works, if you were on GHD with A and B, what would happen is you would first have that Part B deductible of $240. So if you're going to the doctor, outpatient surgery, you had something going on with your hip or whatever it may be, you have the $240 deductible, and then Medicare is going to start paying 80% of everything that goes on. And you're responsible for that 20%. And that's where the deductible, the $2,800, comes into play. So if your 20% ever reaches $2,800, turns into Plan F, 100% coverage the rest of the year. So the worst out-of-pocket situation on GHD, if you are hit by a bus, would be the $240 Medicare Part B deductible and then the $2,800 GHD deductible. So $3,040 max out-of-pocket if you're hit by a bus and you have a catastrophic year. I mean, you could go in and out of the hospital, back and forth. And again, understand, for regular situations, Medicare still going to be paying 80%. So you're only going to be paying 20%. So very difficult to ever reach that $2,800 deductible unless you have a very significant year, which would include an inpatient hospital admission where you would face the Part A deductible. But again, everything stops at that $2,800. So it's a terrific plan if it makes sense. Now, it really makes sense in a couple of states because they have year-round open enrollment, like New York. New York has year-round open enrollment, which they have set up as a state regulation to help you so you can change Medicare supplement plans anytime you want without medical underwriting. And it sounds terrific, but what it does is it doubles the cost of Plan G or Plan N because insurance carriers have to take everybody regardless of health. And they don't want to do that. It exposes the risk factor significantly. So literally, the premiums on G or N in New York are double what they are everywhere else in the state. But Plan GHD is still in the $70 range, which, understanding if we play the game like they have set it up for us to play, where we have year-round open enrollment, we can be on a GHD plan, and then if something significant comes along, we can upgrade to G or N, probably G, the first of next month without any questions asked. All we got to do is put in an application. So those are the things that we help figure out. It is a game. We need to understand exactly how to play it by the rules that are set there. We don't want to break any rules, but we want to absolutely maximize our ability to get the best value from our Medicare coverage. So that gives you a pretty good overview on F, G, N, and GHD. So F, no longer available. G, fantastic. N, also very good, and would choose it if it's $25 less or more in premium than Plan G or GHD. And where I draw the line on GHD on an annual cost, really the line would be about $1,200, $1,300. If it's $1,200, $1,300 a year less in premium, then I'm going to choose that GHD plan, because again, it's very difficult to get to the deductible unless you have a catastrophic year. So you can probably save a significant amount of premium going with GHD. So I hope you found this helpful. If you would, just leave a comment below the video. Certainly helps the video get exposure. And then also consider joining my Facebook group, Talking Medicare. It's a private group, no salespeople, no agents, just talking different Medicare scenarios. You'll learn a lot from other people that talk about what's happened with them or questions they have, and it's really easy to do. Just go to talkingmedicaregroup.com. It'll bring you right there. And I hope you found this helpful. Have a fantastic day. Wait, don't go anywhere. There's a couple more videos right here that you'll find very helpful with your Medicare journey. So take just a minute, watch the videos. You can also subscribe to my channel by clicking this button, and that way you'll have access to all my videos for everything that you need for Medicare. Hope you find it helpful. Have a fantastic day.